Welcome to Healthy Body, Healthy Mind. I'm Dr. Scott McFarland. When it comes to imaging tools, most people think of X-ray or MRI, but there's another one you may never have heard of.
Musculoskeletal ultrasound technology is an application of an existing technology, ultrasound, now in the musculoskeletal medicine area.
The simplest way to think of it is much like a sonar that you would use on a boat.
It's a nice technology because you're able to see muscles, tendons, things you can't normally see on X-ray. You can see it kind of in a live dynamic state with the patient.
As he's looking at the problem, he's actually talking to you and showing you at the same time. So it's making you much more aware of what's going on.
On today's program, we will explore the science of musculoskeletal ultrasound, its application, and the impact this technology will have on the future of medicine.
Major funding for Healthy Body, Healthy Mind is provided by Endo Pharmaceuticals, an integrated healthcare solutions company focused on providing patients with branded products, specialty generics, and a suite of complementary devices and services. And by Amgen, a biotechnology company committed to providing novel therapeutics to address unmet medical needs in the treatment of cancer patients. Additional funding provided by Genzyme, a Sanofi company. And by SonoSite.
The musculoskeletal system is what gives humans the ability to move. It is made up of the body's bones, muscles, cartilage, tendons, ligaments, joints, and other connective tissue. Injuries and other conditions involving these areas can be difficult to accurately diagnose. But doctors have a new weapon in their arsenal: musculoskeletal ultrasound.
Ultrasound uses sound waves to generate an image from tissue within the body. So the sound wave goes through tissue and is reflected back, then the computer can process it and give you an image.
Musculoskeletal ultrasound works by creating a sound wave through what is known as a transducer. The transducer is applied directly to the skin and sends pulsed sound waves into the body. When the sound wave encounters tissues under the skin, the sound waves are reflected back to the transducer as echoes. The time it takes for the echo to travel back to the probe is measured and used to create an image by the computer.
So we'll be scanning your elbow.
Okay.
I'm taking an ultrasound beam through a small little probe. I can actually visualize what's underneath it. Sound waves are projected against the tissue and telling me what exactly is going on underneath there. I can see bone, I can see soft tissue, I can see inflammation and fluid, and those are the things that I'm looking for during an examination. And I can do this real time. I can dynamically move the arm or the extremity and visualize how everything moves together to get not only a static image of what is happening in one plane, but to actually see how things move together.
Musculoskeletal ultrasound images muscle and soft tissue very well. It renders live images which allow the doctor to see beneath the surface of the skin in real time, enabling rapid diagnoses and treatments. Live images also allow for ultrasound-guided biopsies or injections. Ultrasound has no known long-term side effects and rarely causes any discomfort to the patient. Equipment is widely available and small, can be easily carried, and scanners can even be available for bedside examinations.
Hi, Ms. Brown. How are you?
Just fine, thank you.
It's good to see you again.
You also.
How are you doing?
Good.
In terms of ultrasound's ability to image different body regions and different pathology, some good examples would be tendon disorders, where ultrasound really excels in doing that. Entrapment problems of peripheral nerves for some disorders, carpal tunnel syndrome being an example. Ultrasound has a very good ability to see this.
Norma Brown works in the Department of Cell Biology and Molecular Medicine at University Medical Dental School of New Jersey in Newark. After years of office work, Norma felt she was having arthritic symptoms in her wrist and shoulder.
The pain I was having was and my fingers, they were stiffening up, and there were sharp pains. It was like you couldn't bend. It was very, very painful. But I was unable to literally lift my arm, and it was very painful. I actually literally had to use my other hand to actually raise my arm.
But Norma didn't go to see the doctor right away. Instead, she tried some home remedies and a wrist brace to alleviate her symptoms.
I went to the drugstore, I got the wrist band, put it on, and wore it for a while.
After a few months of trying to solve her problem on her own, Norma decided to call her doctor.
When you think about it, it's like, okay, this is not getting better. I need to see what this is and if it's treatable. And that's why I really just made up my mind and said, one day, I'm calling Dr. Stiddick.
So what we've got here is, here's your median. Ms. Brand was complaining of discomfort in her hands and in her shoulder regions. So apart from a routine history and physical examination that we would always conduct, I also used musculoskeletal ultrasound to help diagnose carpal tunnel syndrome in her case. And also I used musculoskeletal ultrasound to image her shoulders and her rotator cuffs and found that she had some rotator cuff pathology.
He said that we're going to treat this with this system. I said I'm going to use an ultrasound, and we're going to literally see what was going on.
It used to be that to get an ultrasound, there were these huge machines that really were only in hospitals or imaging centers. Now that they've become portable, I literally can wheel that around. So I will wheel my ultrasound into patient rooms, I'll wheel it into my surgical center, and I'll scan patients right before surgery to get real-time feedback as to where the problem is, so that surgically I make sure I'm not missing anything when I'm doing the surgery.
It's not radiation, which I think patients appreciate. You know, it's not like CT scan or X-ray in that regard. It's very good at seeing very superficial structures. The resolution on some of these machines is down to 1/10 of a millimeter, so you can see very good resolution of tendon and muscle injuries. It's useful in patients that have pacemakers. So an elderly patient with a pacemaker that may have a shoulder injury and you can't get an MRI, you could do an ultrasound.
Musculoskeletal ultrasound does have its share of limitations, however.
This technology is a complementary technology, so it's not meant to be, and nor will it be, a replacement for conventional radiology such as MRI. It does offer us the ability to do things that MRI cannot do, but MRI, on the other hand, can do some things that musculoskeletal ultrasound can't, so they're used in conjunction. There are some access problems. Some bones are hidden from the ultrasound's field of view. For deep-lying structures within joints, ultrasound has limited ability or no ability to visualize those particular structures.
Once you get inside a joint, say for the knee, for example, you have difficulty seeing the ACL with ultrasound because the bone reflects the sound waves back, so they don't penetrate into the joint. So anything that is going to reflect the sound waves back prior to getting to that object, you're going to have some limitations there.
So I'll let you look at your scan right there.
Musculoskeletal ultrasound allows doctors to quickly image a part of the body, diagnose and educate the patients on their condition, and facilitate the immediate treatment of what is causing symptoms. That's what happened in Norma Brown's case. Her doctor was able to diagnose what was wrong, and then with the aid of the ultrasound, treat it too.
In terms of treatment, she wound up requiring injection procedures, so with the use of musculoskeletal ultrasound, I was able to very accurately inject those body regions, and it led to a very good outcome.
He put the ultrasound machine on, showed me exactly and pinpointed where he would do the injection, and he did the injection as he had the ultrasound machine doing the procedure. It was not painful at all. It was a breeze. I think I was more afraid of the actual impact of the needle, and then he said, "It's done."
The use of ultrasound technology in musculoskeletal medicine has changed how quickly ailments can be diagnosed, and it allows for some patients to be treated on their very first visit to the doctor. This has a beneficial impact on several levels. The overall health of a patient can be addressed more quickly, allowing faster, more accurate treatments and shorter recovery times. In turn, this can help reduce overall healthcare costs. Melanie Cordover lives in South Florida and enjoys a busy life as the mother of 3 children. She loves the sunny climate and has many hobbies and recreational pursuits. But a persistent shoulder pain almost forced Melanie to stay away from her activities.
My shoulder had been hurting, and I wasn't sure what was wrong with it. I thought, someone said maybe it was a frozen shoulder. I said, oh gosh, I feel so young. I'm only 43 to have that kind of issue. Possibly it was.
Melanie was frustrated. She had a hard time getting dressed due to her pain and was confused about what was going on with her shoulder.
It was giving me atrophy, so I couldn't move my arm back. I mean, I couldn't even get dressed. Like, I couldn't even button my pants.
Melanie's doctor used musculoskeletal ultrasound to diagnose her condition. She was a little surprised when he told her what was causing her discomfort.
He took the sonogram, Dr. Levy, and saw a little white hole. He goes, you have a cyst right there on the back of your shoulder. I'm like, really? What do we do now? He's like, we're gonna drain the fluid on it. I was like, really? Okay, thinking I'm gonna have to go for a procedure or whatever. He goes, hold on a minute, let me go get a long needle. And he and his assistant were able to just right in the office, very simply, within a matter of minutes, go ahead, numb it a little bit with anesthesia spray, and probably within a half hour, I was out of the office, and within 24 hours, my shoulder was better.
The treatment can be done right then and there. I mean, once I have the answer, I can immediately make my assessment and plan. If there's a cyst, I can drain a cyst. I can do all of that immediately, often with the aid of an ultrasound to improve my accuracy of treatment.
While musculoskeletal ultrasound is a powerful imaging technique that can confirm doctors' suspicions and inform the patient and doctor about what is going on underneath the surface of the skin, it is virtually harmless, unlike more conventional imaging such as MRI and X-ray.
There is no ionizing radiation at all. One could repeatedly get this examination, and there are no known adverse effects from this. So that does present a major advantage compared to conventional radiology, such as with a CAT scan.
There's no question that the ultrasound avoids the big risks that you associate with a lot of X-ray and CT scan technology. There's no radiation that's being done. Ultrasound is pure sound waves, and so you really have avoided those big risks that people are concerned about of having constant exposure to the radiation that you get with a CAT scan or repeated X-rays. So I think that there's no question that repeating an ultrasound is a lot less risky than repeating a CAT scan or serial X-rays.
Training and staying fit are what 50-year-old Atlanta lumber merchant Don Jacobs enjoys. Don's first experience with ultrasound was a few years ago for bursitis in both shoulders. But while doing some routine work around the house, Don's Achilles tendon ruptured one night.
And when you get to be 50 and you're still trying to train and keep active, things tend to break. And I was walking up my stairs from my basement one Friday night, and my Achilles tendon ruptured. And when your tendon ruptures, it really is quite painful. So I was able to get in to see the doctor and use the sonogram technology to identify that it was a rupture. And I didn't have to go get an MRI, which would have been costly. We were able to get the surgeon in to do the procedure, very quickly on me.
Don's doctor knew immediately what the problem was when he saw the Achilles tendon with the ultrasound.
Tendons have a nice linear pattern. You see the fibers running through the tendon when you look at it from the side. When you take a cross-section of that tendon, it looks more like the bristles on a brush. And so if there's a tear within that tendon, you'll lose some of those bristles. You'll have a hole within the tendon.
Don had his tendon surgically repaired shortly after the diagnosis. And after just a few weeks, Don was up and around again.
Within 4 weeks, I was walking in a boot. 7 weeks, I was in shoes, and I'm now 12 weeks along from that surgery. And I'm hoping in the next couple of weeks that I could start training again and get through this.
Since this technology makes it possible for patients to be diagnosed and treated in one visit, it could have a significant impact on patients' financial bottom line.
A very big factor for a lot of patients, if you give them the ability to return to work sooner, that can be a major help to them financially, economically, to the medical system in general. So the quicker that you can apply a treatment and the more accurately you can do that, that pays other dividends and other benefits, work return, prompter work return being one of those.
So I think that is an area where we'll see ultrasound expanding, is really based on the financial pressures that are being placed on the healthcare system. I believe we'll see ultrasound being used more and more because of its sort of less expensive way of getting some of the same information.
I think that the technology offers the doctors a much quicker way to diagnose the issue. It's immediate. They have the ability to diagnose on the spot, where an MRI you're going, and it's also costly, and you don't get the results back for a day or two with an MRI, and that kind of prolongs your ability to go into surgery. And something like a rupture on your tendon, you want to know immediately, and they were able to that day schedule surgery for me in the hospital. And so it quickened the procedure, and I think that it's a great technology.
X-ray is really kind of a first-line treatment, especially in the orthopedic community. People come in, they get X-rays. I'm of the opinion that ultrasound should be a first-line treatment also. If you have a muscle or tendon injury, you should probably have ultrasound to look at it first, prior to doing an MRI or a CT scan. It's more cost-effective for the patient and for the healthcare community as a whole. It's a cheaper technology, but you don't lose quality even though it's cheaper.
I'm doing well. Ultrasounds are a fraction of the cost of an MRI, and it's more than that, in my opinion. Most of my patients are working patients. To take a day off to come and see me in the office is a big deal. And if I can not only do a clinical assessment, but actually do the imaging to diagnose and finally treat their problem, I've saved them days and days of work. They don't have to spend a half day getting an MRI or another day coming and waiting in my waiting room before they see me to get their final treatment. So I save them time off of work and use a test that is much less expensive than a traditional MRI, and many times can save a tremendous amount of financial dollars to the stress of the healthcare economy.
Thank you.
Glad you're doing well. All right.
Melanie feels that her outcome may have been drastically different had her doctor not had and used musculoskeletal ultrasound to diagnose and treat her condition.
Because the two options were to drain it or have it surgically removed. And if I had it surgically removed, that would be a little bit more difficult in terms of, therapy afterwards. I was trying to avoid any surgery if not needed. I think the sonogram is an important part. I don't think that we could have figured out what was wrong with my shoulder if we hadn't had the sonogram. It's a wonderful situation. Like I said, it's a win-win for the patient, because he could have said, well, I'm not sure, let's do some more exercises and this and that, and he could guesstimate. But here he could actually find out what it was immediately with the sonogram.
All right?
Terrific. Thank you
All right.
so much,
My
Dr.
pleasure.
Levy. I appreciate it
Have
so
a good
much.
one.
Thank you.
Patients are often pleased to see how musculoskeletal technology can be easy to use. They also like the fact that it's a painless and non-invasive procedure. And although standard ultrasound has been around for a while, musculoskeletal ultrasound is advancing the overall use of ultrasound technology at a rapid rate. Physicians who use ultrasound to diagnose and treat musculoskeletal complaints may feel like they're using technology from the future. Coming up, we'll take a look at the role of musculoskeletal ultrasound in educating future doctors. Beginning as a science of navigation, the first form of ultrasound, called sonar, was used on warships during World War II. Today, ultrasound is a 21st century computer-integrated diagnostic tool that provides crisp visual insights into the human body. If you'd like to see this program again or watch any of our other Healthy Body, Healthy Mind programs, please visit our website at hbhm.tv.
Much better. And that makes sense because you're doing much better.
Both patients and providers are fans of musculoskeletal ultrasound technology.
I was surprised at the equipment that was being used, because I didn't think that would be the solution to actually looking at a problem of that nature. It was very easy. very comfortable. It was no problem. It was just the experience of just sitting there. He's talking. He basically takes the ultrasound, puts a gel on, and talk you through it. And it's just a breeze.
It's so easy, and you do nothing. It doesn't make you nervous. The sonogram is so, it's just a little wand over your body, and then you see the x-ray on the screen. So I just think it's an incredible piece of technology that the medical world has.
It doesn't hurt. It's some cold gel while we're doing the exam, and it's that's it, really. I mean, there's really no downside to the patient. It's a fun exam to do. You can learn a lot, and it's relatively quick too. It doesn't take long.
It's really simplistic. It's the new technology that's out there. It's comforting. They're very good at what they do. They're young, they're on top of the technology, they're very confident in it, and I'm here to tell you that it really works. I had really all the confidence in the world being with these guys, and I've gone back, when in need for any other therapy or repair.
As versatile as this technology is, musculoskeletal ultrasound requires special training in order to be properly utilized.
In terms of the ability to interpret and perform scans, there's a very steep learning curve. So both technicians, ultrasound technologists, and physicians who are properly trained, both are capable of doing this, obtaining images and doing image interpretation. It's a very individual thing, but there really is a steep learning curve in this area.
Musculoskeletal ultrasound is a little different, I think, than other ultrasound technologies in that the clinician is usually the one performing the scan. So in vascular or cardiac or OBGYN, lots of times the sonography is done by an ultrasound tech, and then the doctor interprets the images. But with musculoskeletal ultrasound, it's really important to know where the patient hurts, what types of movements bother the patient, and so you can do some dynamic testing under the ultrasound and get a good diagnosis.
You have to do a lot of this to really understand what you're looking at and know how to get the best images. And so, as I learned how to do this technology, I had the advantage of a practice that's just full of patients who have the same problems over and over again. So I'm seeing rotator cuff tears in all different sizes and varieties. I'm seeing inflammation around the rotator cuff in all different ways and impacts. And so I'm seeing that variety, and I'm learning what's what.
Musculoskeletal ultrasound also plays an important role in the education and training of future doctors.
As an educator of our future doctors, our medical students, our residents, and our fellows, this technology has really helped with that. It gives me the ability to show them, right in front of them very visually, pathology. We can correlate that with the physical examination. If the physical examination is suggesting something, that can give them immediate feedback if they were correct in their diagnosis or not. So in many cases, that's extremely helpful.
The patients we met today say this technology has allowed them to get back to their normal lives sooner than they expected.
I hope to get back very quickly and get a good sweat going again, and be able to keep up with it and extend my life, and live a good long life from this.
It's great now that I've had this procedure done because I could get back into my physical exercise. I had stopped doing yoga for a while. I'd stopped doing spinning classes just because I didn't know what exercise would hurt my shoulder worse. And so now I'm back into getting, enjoying South Florida weather, bike riding and going to yoga classes and just enjoying, the lifestyle here in South Florida.
I am able to do the things that I normally had done prior to having the problems. It's totally have changed my activities to the point where I'm able to do it freely without pain or strain.
As always, it was really nice taking care of you.
Thank you so much, Dr.
Take care and good luck to you.
Thank you.
I'll see you. Okay.
Musculoskeletal ultrasound can be a safe and effective alternative to X-rays, MRIs, and CAT scans. Plus, since it allows doctors to diagnose and sometimes prescribe treatment on the first visit, it can be a cost-effective alternative as well. That's it for this edition of Healthy Body, Healthy Mind. I'm Dr. Scott McFarland. See you next time.
If you'd like to see this program again or watch any of our other Healthy Body, Healthy Mind programs, please visit our website at hbhm.tv. To answer any specific questions you may have, be sure to contact your healthcare provider. To comment on today's program, please call 888-380-6500 or email hbhm@itvIsus.com or visit our website at hbhm.tv.
Major funding for Healthy Body, Healthy Mind is provided by Endo Pharmaceuticals, an integrated healthcare solutions company focused on providing patients with branded products, specialty generics, and a suite of complementary devices and services. And by Amgen, a biotechnology company committed to providing novel therapeutics to address unmet medical needs in the treatment of cancer patients. Additional funding provided by Genzyme, a Sanofi company, and by SonoSite,